Thank you, Tom, and good afternoon, everyone. Before we begin, I want to update you on the technical issues that have been affecting our reporting system. Teams at Alberta Health and Alberta Health Services worked all weekend to fix the problem. We are updating our dashboard today, including case breakdowns by zone and updates of the school and relaunch maps. The only outstanding issue involves our total overall testing numbers. There is some final data that is being reconciled, and we will have that information updated as soon as possible later this week. We have committed to being as timely and transparent as possible. I know that many people care about this information, and I thank you for your patience during these last few days. Turning to today's numbers, we have identified 644 new cases of COVID-19 in Alberta. There are now almost 8,000 active cases in the province. Currently, there are 192 people in hospital with COVID-19, including 39 in intensive care. As I've said, it is vital that we protect the health system. These numbers are concerning, and we are considering what further steps may be needed. We are confirming the exact figure, but about 13,000 tests were conducted yesterday, with a positivity rate of approximately 5%. Sadly, I must report that there have been 7 new deaths. I extend my deepest condolences to anyone who is grieving today. Each death is a loss for our community and a reminder of the importance of containing community transmission. We cannot simply dictate where and when this virus will spread. We all need to protect each other. Turning to schools, as of today, there are active alerts or outbreaks in 285 schools. That is about 12% of the schools in the province. Currently, these schools have 911 active cases in total. This number includes 57 schools that are currently on the watch list. So far, in-school transmission has likely occurred in 123 schools. Of these, about half have had only one new case occur as a result. I also want to let Albertans know that outbreaks have been declared at 2 sites supporting vulnerable peoples in Calgary. An outbreak has now been declared at the Calgary Drop-In Centre. There are currently 11 cases identified, and widespread testing is underway. Outbreaks have also been declared at both Alpha House, where there are 2 cases, and one of their transitional housing units, where 5 cases have been identified. We are taking these outbreaks extremely seriously. Health screening of all staff and shelter clients is underway, and on-site testing is being conducted. AHS is working with various government and social agencies to support those who've been impacted. The risk of spread to this population is a reflection of the larger community spread that we are seeing, and another reminder that we must protect each other. Rising numbers also make it more challenging to participate in some of our upcoming traditions safely, but we can still honor these traditions with some changes this year. Today I want to recognize Remembrance Day and Diwali, both of which are coming up this week. Remembrance Day is on Wednesday. I know this is an important and solemn time where we come together to honor sacrifice. While ceremonies and tributes will look different this year due to COVID-19, we can still commemorate this day while protecting one another. A number of annual large-scale events throughout the province have moved to a virtual format, and many legions will be holding smaller gatherings for their members. I encourage you to participate virtually if possible. For those organizing ceremonies or events this week, please respect gathering limits both indoor and outdoors. And remember, smaller is better right now. Organizers should consider ways to screen people who are attending to confirm they are not symptomatic or close contacts of a confirmed case. Most importantly, if any of us are feeling unwell, we need to stay home and recognize this day privately. I know this is a sacrifice, but it is an important one. We have posted advice on alberta.ca for Remembrance Day, and I will tweet out a link today. It is also Diwali on Saturday. I know the Festival of Lights is a very special occasion for many Albertans. As with Remembrance Day, I am not asking you to stop celebrating this occasion, but it is essential that we consider COVID-19 while planning and attending any events. If you are in Edmonton or Calgary, please do not plan to host anyone at your home who does not live with you, and please do not attend a gathering at a home where you do not live. Outside the home, keep your gatherings as small as possible and no more than 15 in total when in any area of the province on enhanced precautions. Connect with others virtually whenever possible. Please wear a mask whenever you are in close contact with anyone not from your cohort, especially while you are indoors. And I need to stress that if you are sick with even mild symptoms, you need to stay home and attend virtually or celebrate in private. I, like many others, am extremely concerned by the spread that we are seeing. This weekend, we saw a daily record for new cases reported on Saturday, followed by high numbers on Sunday and today. Although the last few days have been a bit lower, we expect some variation from day to day, and we have not yet turned the corner that we must turn. Cases continue to rise, and if we do not bend the curve back soon, we may see further surgeries being postponed or other impacts on health services. It generally takes 1 to 2 weeks to see the impact of new measures like the ones that Alberta announced on Friday. However, the rate of increase and rising hospitalizations are extremely concerning to me. We are assessing measures closely. If needed, we do not need to wait 14 days before recommending additional measures. This is a critical juncture, and we need to get our cases down to below 100 new cases per day in our big cities with a growth rate, or R value, of less than 1. Our growth rate has risen in Edmonton to 1.1, up from last week. In Calgary, there is a slight decline, but still a growth trend at 1.1 as well. And in the rest of Alberta, the growth is even higher, with an R value of 1.2. We can only change this by working together. I want to end today by speaking directly to those people who feel they are not at risk right now. After 8 months, I know that some people have let their guard down, often because they have not personally contracted the virus and they don't know anyone who has either. Why take extra precautions? Why limit what you do when you have not gotten sick? I understand the fatigue and frustration and the desire to go back to the old normal. But COVID-19 does not play favorites. It is in every part of our province. Every community has been touched by it. We've seen this virus spread from 1 case to dozens in a few days, and from a few hundred to almost 1,000 in a week. If you have not gotten sick, and if you don't know anyone who has, then you must do everything possible to keep it that way. We all have a role to play in suppressing transmission, and together we have the power to lower our case counts. We all must seize the opportunity presented to us. We are strongest when we all work together. Thank you, and I'm happy to take any questions you may have.
All right, we'll go to the phone now. We have a very full queue, so please limit it to 1 question and we will get through as many as possible. Operator, could you put through the first caller, please?
Yes, first question is from Elise Stolte, Edmonton Journal.
Hi, Dr. Hinshaw. Many parents are nervous and looking for data on in-school transmission. Of course, that's the figure that would tell them how much going to school increases their risk. But as you know, that data has only been released province-wide, and the practices that school boards are using to reduce that transmission vary by a lot. Can you tell me why Alberta hasn't shared that data, school board by school board, to date? And do you have plans to share it soon?
Thank you for the question. Information that would be shared school board by school board would be information that would need to be released likely by Alberta Education. In Alberta Health, we typically track the transmission by the AHS zones, which of course would have several school boards within them. So the complexity of the tracking of in-school transmission by particular school boards, which may have schools across the province or perhaps in one geographic area, would be quite challenging. I understand that parents are interested in knowing where there has been in-school transmission, and We have been working over the last many months to try to be as transparent as possible with respect to school data. So that request is something I can take back to the team and see what we can do to look in more detail at what information we can provide. But again, at this time, we in health do not have the ability to report school board by school board. However, we can look potentially at in-zone reporting.
Operator, could you put through the next caller, please?
Yes, David Staples.
Hi, Dr. Hinshaw. Right now we have a number of voluntary measures in place. And I'm guessing that they're voluntary measures because there's good science backing them and you want these things to happen. Is there any thought about making some of the voluntary ones now mandatory? And if so, what are the one or two ones that are being considered right now to be moved towards mandatory?
We know that our cases are arising in large part from close contact, particularly in households and in social gatherings. And as you say, that is why we have focused our restrictions on those contexts. We also know that in workplaces, we're seeing co-workers who are perhaps considering themselves to be a cohort and not taking any precautions when they are with each other. And so some of these measures really are challenging to make more mandatory. But what we are doing, of course, in the social gathering is requiring in any area of the province that has 50 active cases per 100,000 or at least 10 cases, that 15-person cap on social gatherings is a mandatory requirement at this time. So that is no longer voluntary, and that does apply across the province wherever a municipality has has hit that threshold. With respect to consideration of other mandatory measures, again, we are looking at where our case counts are highest. Some things we can make mandatory, others. I've talked about the importance in a household when someone is either a close contact of a confirmed COVID case or if they get symptoms. It's really important in that household that that individual be isolated away from everyone else they live with as soon as possible. But that's not something that we're going to be able to make mandatory. That's something we need to rely on Albertans to work with us. And when we see, again, that 40% of transmission in households and those social gatherings together, we know we need to focus on that. But some things, again, we really have to work together with Albertans, and other things we can potentially consider those mandatory restrictions.
Operator, could you put through the next caller, please?
James Keller, Globe and Mail.
Hi there. We've heard in the last little while from some experts this idea of a short, sharp lockdown compared to a circuit breaker, and we've had several dozen intensive care and ER physicians in Alberta sent a letter, I think today, calling for this type of measure to bring cases under control. Can you tell us, what is your view of this idea? Do you think it could help with the current situation in Alberta? And how do you respond to the arguments that from some experts that Alberta is placing economic concerns ahead of public health?
First of all, I think the circuit breaker idea is an interesting one. It's what British Columbia announced this weekend, and so you'll note they've targeted some of the same kinds of activities that we are targeting here, but of course they've focused on particular geographic areas, again, as we have here, where they're seeing transmission, and then made that next step of doing some additional mandatory requirements in a very short time frame, so the 2-week time frame in BC. It's an interesting idea. As I've said before, when we're looking at all of our options, we know that there is no one perfect way to manage our COVID-19 experience. We need to look at all options on the table, including something like that circuit breaker, including what we're doing now, which is giving Albertans every opportunity to walk along with us, to come alongside and be a part of the solution before we impose restrictions. The question about whether we're putting economic concerns ahead of health concerns, I've been really clear that in my job, I'm responsible for all aspects of Albertans' health, and that includes protecting people from COVID-19. It also includes considering the health impacts of the restrictions like isolation, such as unemployment, and so trying to consider how we can proceed in the best way possible to balance out those two things. As I said last week, we are losing that balance, unfortunately, and we are seeing COVID-19 starting to tip the scales, so we do need to work to get back in that balance. But again, there's no one single right way to do that, and all of these options are on the table for discussion.
Operator, could you put through the next question, please?
Thank you. Michelle Belfontaine, CBC.
Hi, Dr. Hinshaw. Actually, James Keller just asked my question, but I do have a follow-up to what you answered. So first of all, has the 2-week lockdown idea, like the circuit breaker, has that ever been seriously discussed? And you talk about, wanting to encourage Albertans to walk along with you. How much longer can we wait for the measures that are currently in place to have an effect before taking more measures?
That idea of a circuit breaker, again, is one of many options under discussion. So every action that we take has advantages and disadvantages. Every choice for managing this pandemic comes with downsides. So unfortunately, there is no easy path through this. With respect to how long to wait, we know that when COVID-19 starts to escalate, it can do so very, very quickly. And as I said earlier, this is not something that we can necessarily wait a full 2 weeks between taking one step and then considering others. So right now, we're again watching our numbers, we're watching our hospitalizations very closely, we're having active discussions about multiple options, and again, trying to make the best decision possible for Albertans, because ultimately, we know that whatever measures we put in place, mandatory or voluntary, they are only going to be effective if Albertans come along with us and follow those measures. And so we need to make sure, again, that we are working with people as much as possible. And that's what we've been trying to do. Again, we've been able to slow the growth somewhat, but we haven't been able to slow it enough. So we are looking again at those other options and what timing we would consider based on where our numbers go.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. Demand for testing continues to be high, and of course this is not happening only in Alberta, but across Canada and the world. How much supply strain are Alberta labs seeing when it comes to swabs, pipette tips, and reagents? Are there concerns that at some point there will not be enough supply to meet demand? And if so, what's being done about that?
We work with Alberta Health Services very closely, but as you know, because Alberta Health Services is such a large organization, and Alberta Precision Laboratories as part of AHS does have that advantage of being a very large organization with really good supply chain contacts. The benefit of that organization is that they have been able to manage any supply issues that have been identified in the past. They have been able to find creative solutions, work with local partners, procure things from vendors around the world. And so, of course, with demand for test supplies very high around the world, as you say, it's something they are constantly mindful of, and they do a really excellent job of making sure that they're anticipating where there may be challenges, looking for options, and finding creative ways that can get the supplies that are needed and make sure that our testing remains robust and accessible to Albertans.
Operator, could you put through the next caller, please?
Don Braid, Calgary Herald.
Dr. Hinshaw, this morning we got word of a potential vaccine, which seems to have experts around the world quite excited, unlike some of these announcements that seems to be taken very seriously. And it's possible, according to Pfizer, that we could see this within months. If so, it would be very good news. I'm sure we'd all agree, and nobody would be happier than you. But would you be possibly concerned that growing word of vaccines coming could actually make people a little more careless? How do you deal with that phenomenon, if indeed you think it is one?
It's a good question. I think that the promise of vaccines is, of course, encouraging, and we are watching developments in different studies in the different types of vaccines around the world very closely. We're working with partners across the country, other provinces and territories, and the federal government to get vaccines when they are available. But what I would say to Albertans who may consider the possibility of a vaccine being available within a few months, perhaps as justification for not taking our current measures seriously, is that a few months within the life cycle of how COVID transmits can be a complete game changer. We have seen in the spring, we saw places like New York City and places like Italy really explode with cases in the matter of weeks. And so I think what I would say to Albertans is it is good news, and we are watching those vaccine developments closely. But a few months away is a bit of a lifetime away in terms of being able to change our behaviors right now. We're at a really critical time. We're going into colder weather, winter weather. We know that the virus transmits much more easily indoors than out. And we know that when people are spending time in those close quarters, we can see very quick spread. So now is not the time to ease off. And when that vaccine becomes available, it's likely only going to be available in small quantities. And we will have to make sure that we are prioritizing for those who are at highest risk when it first arrives. So we unfortunately do have to keep on holding on to our public health measures and looking for that vaccine as a good news story, but it's not here yet. And so in the short term, we need to protect each other with our actions until we have that vaccine in our hands.
Operator, could you put through the next question, please?
Tom Ross, 660 News.
Hi, Dr. Hinshaw. When we talk about the amount of cases being linked to social gatherings and stuff, there's still a large portion of cases that aren't accounted for. So how do we know that we're truly ahead of the curve and truly targeting the right places when there's still so many cases that we aren't able to trace?
It's a good question. And again, we're working to try to bolster our contact tracing capacity and try to get some of that information. Excuse me. But what we are doing is looking at places that we know in other provinces they've seen issues. We're looking at our own data, and we know that what we have seen in terms of our trends where we can trace the source is very similar to what other provinces are seeing, even those provinces that have fewer unknown source cases than us. So what we believe is that although we don't know for sure that proportion of cases where they came from, the relative distribution is likely, based on our own evidence and the evidence from other provinces, to be from some of those higher risk places. I would also remind people that we have been really encouraging people over the last week or so to download the AB Trace Together app, which will help us to make sure that those who may have been in contact with someone who was infectious can get that notification, even if it is outside of one of those known settings. And although Alberta Health Services is focusing their contact tracing on high priority areas, they will absolutely be contacting everyone who is identified through that AB Trace Together app as having potentially been exposed. So that app remains effective for those who've downloaded it and can be a help for us in that 40% or so of cases where we don't yet know where they've been exposed.
Operator, could you put through the next caller, please?
Yes, Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. I'm just wanting to touch base on the hospitalization and ICU rates. I know we've had some issues with data, so I'm hoping you can tell us what the increase is in the hospitalization rate over the 2 weeks, how close it is to the 5%. And we've now passed the 50% threshold in ICU with about 56% if that 39 cases in ICU is translated over. 50% was the trigger for more measures or restrictions. Can you give us an outline of what those will be and when they will be implemented?
So we have been watching that closely. I don't unfortunately have the hospitalization increase numbers with me. They have not crossed that 5% mark in the last few days. But as you say, we have crossed that 50% ICU metric. What we have been doing over the past several weeks is, while we've been watching those metrics, we've been also watching metrics like the capacity, the overcapacity in different zones. So as I've said before, the Edmonton zone did reach that 120% capacity, which meant they had to stop many elective surgeries. And what we realized is that the metrics that we set out in the spring were important, but they were not sufficient. And so we have already been using some of these other metrics, such as that overcapacity, such as the increasing new case counts combined with our reproductive rate, or R, to put in multiple new measures over the past several weeks. Of course, now that we've crossed this 50% of ICU capacity, as I said earlier, it is concerning. And as I said earlier, we are looking at other options and what other measures we may put in place. But final decisions have not yet been made on that. And again, what we implemented on Friday is important and will help if people follow these measures that are in place, both the mandatory and the voluntary measures. That will help to bring down our transmission as we continue to consider what additional measures may be needed.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Shannon Scott, CBC.
Oh, hi, Dr. Hinshaw. I have a question about these the new voluntary restrictions that were put in on Friday about not having people into your home. I'm wondering what you would suggest or say to people who live alone and how that can impact their lives.
Absolutely. And as I mentioned earlier, one of the considerations with any new measure are the unintended consequences, the health consequences that those measures have. And for those who live alone, I would suggest that they could consider whether going to perhaps an outdoor location, so going for a walk with someone, and I know the weather is not great right now, but there certainly are activities outdoors that can be done for many people, and so that's one option is planning social gatherings, small social gatherings outside. Also planning them in structured settings. So there are many locations, many restaurants that have put in really excellent COVID prevention measures, and so having getting together with a friend, another friend in one of those settings could also be something that they could do. And I think at the moment, again, we're really focused on wanting to bring those numbers down as much as possible. And while I recognize this is a sacrifice, as quickly as we can bring the numbers down will mean that we can start easing off of those restrictions again.
Operator, could you put through the next caller, please?
Francois Joly, Radio Canada.
Hi, Dr. Hinshaw. Going back to the question of restriction, we've seen, we talked about metrics and threshold that seem to be kind of really reactive to the state of the virus. And knowing what we know now, the rise in cases over the last few weeks, should Alberta have been more proactive? Would you have, knowing what you know now, would you have done something different over the last month?
I think in Alberta, like some other places around the world, we implemented measures very quickly in the spring. And because of how quickly we acted, we really didn't see significant spread here. We saw nowhere near the numbers of hospitalizations that we could have seen. And in some ways, I think that we are a victim of that success. So what we know about COVID is that it can grow very quickly, that the transmission rates can change within a matter of weeks, and it can take off. So the earlier that we put in measures, the lower we can contain it. But we also know that the measures that we put in place have to be effective, not just based on the evidence of what measures work best, but also based on what measures we can work together with Albertans on. And so I think that if we had been able to do different measures sooner, it could have changed our trajectory. And on the other hand, I'm not sure that putting things in place that would have had significant impacts on the other aspects of people's health at an earlier point in time would have actually succeeded in having Albertans come alongside us and accept those measures. It is a delicate balance, and we do need to make sure that, again, whatever measures we're putting in place, they balance the impacts of COVID, the impacts of the restrictions, and that they will be effective in having the majority of Albertans accept them and put them into practice in their daily lives.
All right, operator, could you put through the final question, please?
Yes, Jerry Tate, Globe and Mail.
Hi, Dr. Hinshaw, can you clarify what you had just said on the app? If I understood you correctly, you said people who are using the app will be contact traced, even if they're not in those 3 priority groups. That's contradictory to what we were told last week. What is it now?
The difference between someone who has the app and is in a non-priority setting or kind of not part of one of those continuing care, healthcare, or schools, and someone who does not have the app, is the amount of time it takes the contact tracer to talk through all of the different settings that that person was in, who they were in close contact with, and it's that volume of time that it takes to work through getting that narrative history from someone that the contact tracers, unfortunately, right now, they simply don't have the ability to do all of that and in a timely way do the contact tracing in high priority settings like continuing care, healthcare, or schools. But when somebody has the app downloaded, they're able to get the key from the Alberta Health Services contact tracer and the contact information for anyone around them who had the app and who was in close proximity within the time they were infectious. The contact tracer gets that immediately. So there is no time that needs to be spent in getting that detailed history to try to work out who those contacts are. And that's the difference. So someone who does have the app, those contacts will be notified, and that may be through a text form or a phone call, again, depending on the processes that are being worked out. But it is because the app speeds up contact tracing and makes it more effective and efficient.
Thank you all for joining us. Dr. Hinshaw will provide another update on Thursday afternoon. As Dr. Hinshaw mentioned, the website is now updated daily and will continue for the foreseeable future. Have a safe night.